So let's understand a little bit why nurses strike in the first place. Most of the time, they're going to strike due to unsafe working conditions, ratios, pay is being a problem, lack of support, poor communication. Those are the main reasons why nurses strike. So there are some nursing unions. Lots of times they strike because their contract hasn't been renewed, because when you're a nursing union, you have a contract with the facility or with the management team or whoever's running the show. You have a contract, and you have a contract because everyone comes to the table of discussion and speaks what they want. And how are you going to compromise on what you're willing to sacrifice, what you're not? You're willing to negotiate over the things that you want and some of the things that you're okay with not having. And if you sign into a contract, both parties have to abide by that contract. So if a contract gets expired in these union hospitals, that's expired, you say it's no longer valued. Lots of times these hospitals do comply with these contracts that haven't been renewed, but in lots of cases, the part that gets affected the most is the pay. Meaning if you haven't renewed your contract, then whatever pay you're promised in that contract, technically they don't have to follow. And that's the one thing that they're going to follow the least, because when it comes to money, people don't like getting their money messed with. Even nurses don't like getting their money messed with. And that's fine. I don't like my money getting messed with. I don't think you like your money getting messed with. So that's kind of the way it works. If you're going to get overcharged for something, you're going to most likely not come back to that place, or you're going to argue of you being overcharged and why it happened. You want a refund. Same with these hospitals. They're not going to pay any more than they really want to or any more than they really have to. And that's a lot of times why nurses strike. The pay is going to be the major reason why nurses strike. So ratios and pay. The environment, we could kind of work our way around that, but a big factor in the environment is ratios and staffing. So technically, those are like the really big ones. For the most part, I want to say pay is probably the biggest, because let's all be realistic here, guys. Let's just say you're a nurse making, let's just say $70 an hour. Okay? Simple math, $70 an hour. You don't have the ratios, but if your pay jumped by $10 from 70 to 80, you'll probably be able to work with the ratios. And see, that's where the whole negotiation comes into play, because if you don't want to give me more money per hour, well, then at least give me more staff so I don't have to, for example, work as hard. And I'm not saying that nurses don't work hard. I'm not saying that proper ratios are going to make people work less. It's just we're working more than technically we should, because you're not abiding by these ratios. So you're expecting me to do more with less, and you're not giving me any kind of breathing room. If you expect me to do more work with less, at least compromise with me on paying me more. Because if ratios are 2-to-1 and I've been doing 3-to-1, 4-to-1, hopefully not doing that in the ICU, but just for simple math, I'm giving that idea. If you're doing 1-to-3, technically you're working for 1.5 nurses, right? So why aren't you being compensated in that way? If they don't want to hire that extra nurse, well then why should you not at least be getting paid more if you're doing more of the work? No, common sense, but there's always that battle. You have to fight for your value, because the person that's paying you isn't going to value you at a reasonable rate, at least not financially wise. Maybe they'll value you as an employee, tell you, hey, you're doing good, thanks so much for staying in, thanks so much for coming in, thank you for staying over, thank you for overtime. They'll shower you with compliments, but what do compliments really do in reality? They make you feel good for a little bit, and then what? Nothing really else happens. You go home, okay, what changes? You're taking all the loss. Yeah, they might make you feel good for a little bit, like, yes, people feel appreciated that I'm stepping up. I feel appreciated because people are making me feel appreciated. But at the end of the day, you're coming back home stressed, more tired. Now you're even hungrier. Now you got to buy more food. You're financially taking a hit in a way. Taking a hit financially, mentally, spiritually. Yeah, you get paid the time and a half, but that's only an hour or two that you stayed over for the time and a half. But the whole shift for 12 hours, 13 hours, for that 14 hours, you're doing time and a half physically. But you only got paid time and a half for the last 2 hours. doesn't really feel fair, but they'll try to make you feel appreciated. They'll try to do certain things for you that don't really almost mean anything for at the end of the day. Because lots of times management comes up to you, asks you for a favor, and you do it. But a lot of times you come up to the manager, you come up to the hospital administrators, you ask for a favor, they're not gonna give you that favor. You ask for maybe a day off when you ask them to come up, the PTO. They don't always want to do that. They don't always want to do that favor, right? Of even if you have a little bit of emergency, maybe if you're not even feeling well, you don't got any more PTO, or you just knew. It's really hard for people to do your favors, but it's a lot easier for you to be doing the favors. A little bit of a reality check right there, and a little bit of a life lesson